Well, the reality is we've had three different bills. We had the tri-committee bill, which was what they used to have a couple days of hearings on. And then the day of the markup, they dropped another 1,000-page bill, which we had not seen. And then when we started moving into the markup, they dropped another 75 pages in a manager's amendment. So the reality is the goalposts keep moving, and it's very difficult to say you've read the bill when you don't know what they're going to present, and they keep changing it. Well, I think the reality is they don't want us to read it. They don't want to give us time to take it out to the public, to show how people will be affected, both positively and negatively. And they have us, in essence, captured here. They're using the twisting of arms and breaking of legs to try to get the votes to pass it on the floor, so then they send people out to try to defend their vote, versus allowing us the month of August to really take the time to educate our constituents on what is in the bill and what is not in the bill. Well, what the president has promised will not happen. He has promised that if you like your health insurance plan, you'll be able to keep it. That is an absolute incorrect statement, because what will occur is a couple things. If you're a multi-state employer, ERISA, which allows you to provide insurance for all your workers under the same umbrella, will be changed. There will be also an effect on the public insurance option, where it'll cost less than private insurance because it's going to be backed by full faith and credit. They're not going to have the capital requirements that an insurance plan has to do. And then people will start jettisoning their employees to the public plan. We call that crowd out. And when that occurs, you're going to have one insurer left, and that will be the public option. And the only way you control cost under a public option is to ration care, which is exactly what we see in the UK, New Zealand, Canada, and Australia. Well, they do nothing to address medical liability reform. And that is, there's two cost drivers in medical liability issues. One is the pain and suffering damages, not the economic damages, but the additional cost on pain and suffering, and the medical insurance that the doctors have to purchase to defend against that. And then there's what is called defensive medicine practices. Doctors doing countless other type of evaluations of a patient because they want to protect themselves against suits, not basically because those type of additional tests are needed. So many times they're done just to protect them from liability. That drives up the cost of health care. Well, again, as you talk about the system in the United Kingdom, it's a ration care system where you have a board that was originally established to look at cost-effective practices that now has become a rationing board, where people who need catastrophic coverage and they need immediate access to life-saving drugs are put on a waiting list, or they can't get care that they need, and a lot of them come to the United States to have access to care. They have to pay for it out of their own money, versus our system that it doesn't matter your ability to pay. If you need catastrophic, life-saving access to the best medical doctors in this country, you will have access to it. Well, a government bureaucrat would. Again, very similar to what we see in the United Kingdom under their National Health Services. They have a board called NICE, and that board makes determinations of who gets access to care, and they do it by a formulary and how much does the care cost. In essence, how are you, will it affect your standard of living? And it's a terrible way to, people who are ill or have enough stress and strain on their lives versus having to fight against a bureaucrat who's going to make life-saving determinations based upon some formula. Medicare? Well, I think the Democrat plan harms both Medicaid and Medicare. Some plans say that some costs will be taken out of the current Medicare system, which is going broke to begin with. The other thing that you always hear is that, well, the overhead for these programs are very low, and that's why we ought to move in a program very similar to Medicare and Medicaid. The problem with that is the waste, fraud, and abuse under Medicare and Medicaid are in the billions of dollars, because there is not the focus on making sure that we're paying for real services rendered under a government system. Well, it's not supposed to cost anything according to the president, because it's supposed to be a cost saver. It's supposed to bend the cost curve down. What we see that this plan is doing, as scored by the Congressional Budget Office, is bend the cost curve up. So over a 10-year period of time, we're looking at $1.2 trillion. And that's at a time when we're already in deficit spending, and we already have increased the national debt to $11 trillion. There's also a new recent CBO report out, asked to be produced by Joe Barton and Dave Camp, which says that this bill adds to the deficit up 10 years and the national debt. Well, the last thing when you have a down economy is to put more burden on the employers who are trying to turn a profit to keep people employed in their facilities. And you still want employers to be able to offer quality health insurance. As costs go up in the health insurance arena, CBO says costs will go up in the public option plan and in the private option plan. That makes it more difficult for the employers to keep and maintain employees, where if they have a facility that has 50 employees and healthcare costs go up, they may have to go down to 48 and save the money for salaries to help pay in the additional health insurance premiums. Well, they need to talk to their member of Congress, and what we need to do is, there are estimated 47 uninsured Americans. That's really broken up into 3 categories. One category is people who could pay for some type of health insurance policy, and we need to help direct them in that manner, whether it's medical savings accounts, catastrophic coverage. We could give them a tax deductibility ability so they can write that off their insurance. We could help them get into pools, which allow them to, if they're a member of a fraternal organization, maybe like the Knights of Columbus, that they could join together and then have buying power. There's a lot we can do. There's about a third of those folks who can have access to government programs right now. They're either unwilling to, or they just don't know about them. And so we need to help educate people and get them into the government programs. Again, the final third are the ones that we need to make sure that we can help them get into a private insurance plan. And if they can't do it on their own financially, and they can't be in pools, then that's the time when we need to step up. And instead of giving them a public plan that will ration care, which many members aren't willing to accept on their own, we ought to give them the same type of insurance policies that we have in the private market. And that's where we ought to be focusing on.